Hey, folks, welcome to Dentist in the Know. This is the podcast where dentistry meets real talk and just the right amount of sarcasm. Sorry about that. I screwed that up. We're pulling back the curtain on the industry, talking to the experts, the innovators, and the everyday clinicians who are out there doing the work. No fluff, no filter, and definitely no sales pitches disguised as education. If it's happening in dentistry, from clinical breakthroughs to regulatory curveballs to the latest scandal at the ADA, oh my gosh, there might be one. We're probably already talking about it. And yes, we're bringing the receipts. So whether you're a seasoned doc, a curious consumer, a rep, a researcher, or just here for the drama, welcome to the show. Because around here, we're not just in the loop, we're in the know. How you like that, folks? I'm Dr. Chad Duplantis, and with me is Dr. Jennifer Bell. And I believe we have another co-host that might or might not be with us, but
I don't see him. But he may come back. He may come back.
Yeah. I think he's in like the Sky Club at whoa.
Okay. Is it just me? I don't know. I'm going to keep going live because the ticker is still going. Wow. It's been one of those weeks. I did a webinar last night and there was a storm that was happening and it was kind of impacting our connectivity issues as well. And we never know when we're live, if it's actually me, or Chad, or Jeff, because we're all feeding off of each other. So, hey, DINKs, welcome to another live episode. Honestly, I feel like maybe we shit the bed tonight. We were late getting on because we're trying to put the pieces of the puzzle together, doing dentistry all day and managing life after 5. And Jeff is traveling. He's on his way. Actually, can't remember where he's going. And then I'm actually heading towards Dallas this weekend. I'm teaching for Benko, a really cool program that they do for doctors who are growing, expanding, or starting their own practices. We talk about a lot about office design. There's a great speaker there that does office design discussions. I do digital platforms and how we look at bringing on different digital technology to be a part of your new practice. And then there's a lot of other speakers that talk about financing and all the stuff that you have to know as a young or new doctor or a doctor looking to expand and grow your footprint. So it's a really fun event. I also love being in Dallas. I'm going to get to see Chad. But also my sister lives there and I get to see my really, really cute 5-year-old niece, which I'm kind of obsessed with. So I'm really excited. I hope your week has gone well. It's been a pretty good week. You know, what's really weird about dentistry in general is that when I come into the operatory and into the doctor's office after I've seen a few patients and I say to an associate or my partner, man, everyone is just being so nice today. And you have to call that out sometimes, right? Because sometimes they're just not so nice. And I get it. They're dealing with their own personal stuff that's going on. They're dealing with not liking to be there. They're afraid of us, etc. So I totally get it. But it's funny when you do have to call it out because it is a bit of an outlier every now and then. Hi, Jeffy. How are you?
Hello, my fair people. I have just gotten in trouble in the Sky Lounge C of Atlanta Hartsfield.
How's it going? Where are you headed? Remind me because I couldn't remember.
I'm on the way to Sarasota for a Aligned Dental Partners meeting. And I really thought I was going to be able to do a segment from the Sky Lounge. What I did not count on was the fact that I would be in the C concourse where there is absolutely no private area whatsoever, and that there would be some angry people at the sound of my voice.
Well, if I kind of can get that. It just happens sometimes that we're all a little annoyed with the sound of your voice. We missed the intro from you. So just tell the people there, I get it. Put me up on the big screen and, we'll have like a sympathy party.
No, I actually found a little private area where normally the Delta rep would sit, and there is no one in the seat, as you can see. So it is just me, but I have found the only quiet area in the sea lounge.
Well, I have to tell you sound a little bit like we've hired an AI robot for our new co-host position. So maybe that's an idea. We can just phone this in. We don't have to do this live every week. If we had an AI robot that could do the show for us, don't you think?
What would happen if DINKs representatives were there to suddenly tell you that you were a dental rock star?
I don't know what you just said.
Didn't you
What
hear
about
that?
being a dental rock star?
I was trying to be an AI person.
Well, you actually kind of sounded like it. And I was like, oh, if this feels like self-driving mode. I don't
Yeah,
know.
that's exactly what it was. But anyway, I'm excited to be on. I did not want to miss the Shofu episode. That was so important to me because they are such a great partner to us, and they play such a big role in my practice as well. So just didn't want to miss this. And even though I'm traveling tonight, it just needed to be a part of. It needed to have my presence.
I agree. I
Yeah,
didn't even know Shofu existed until I met you guys. And now I can't imagine practicing without it. So,
yeah.
um,
That's kind of crazy. I had no idea. Like, I didn't know that there was anybody that didn't have some Shofu products because, I mean, they were like when I started dentistry, it was like, okay, everything polishing was Shofu. And then, so that was already in my office and I was already exposed to the products. But then it became, okay, they're getting into the restorative world now. And now with Geimer technology and having like the ability to have a resin material with, you know, possibly some possibly some remineralization. It I just don't understand how more people did not make this a part of their everyday practice.
I could not agree more. Now that I know, but I swear to you, I really didn't know, and I really don't even think I was using any of their stuff. And it wasn't because I didn't like it or make that choice. It just hadn't been exposed. And I think that's true for a lot of dental companies out there, manufacturers. Like if you don't know they exist or they don't have the big marketing budgets or the big salespeople that are coming into your office, you just don't know that they're there.
Yeah, no, I totally agree. But yeah, luckily, just got exposed to it early, got to use a lot of it. And then they keep coming up with these like cool and innovative products now, though, too. Like things that not only help you from a restorative perspective, but also from just in the operatory. The dental eye camera to me is the biggest no brainer in dentistry. Like literally
Are you
something
talking
that,
about this?
oh, you have yours with you. Is that a C5?
No, I don't. I have how do I know which one it is? I have the
It'll,
C3.
oh, yeah.
I'm at old
So
school.
don't apologize. I have the C3 as well. And the damn thing is still performing so well that I've not upgraded yet. It's just if you're buying new, you will get a C5 now
Right.
with a few more features. But the C3s that I have had in my practices have functioned so well and have performed so well. They're still being handed all around the office and just work beautifully.
Okay, you know what? Would you say that that is your favorite Shofu product?
No, I
Okay.
can't. So it it's funny. It really is a tie because I love that. And I don't know why any human being would not walk around with beautiful Flow Plus X in their pocket at all times.
Oh, you mean this?
Oh, you're hysterical.
I do carry it in my pocket.
I carry the syringe with me because people are just used to seeing me with a syringe, and no, it really is it is just such a universal material that can be used. Anytime you want to prevent secondary decay, a great flowable material, really polishable. I use it for class fives. I use it for incisal edge buildups. I mean, I just do so many things with it, and mostly my attachments for aligner therapies, and it's just one of those materials that just always has to be nearby.
Okay.
So, hey, I'm going to jump in
Oh, hey,
because
Chad.
if it's not one thing, it's another. All of a sudden, I got this update warning, and the computer just completely shut down. StreamYard updated, then my computer updated, and so I got kicked out. But I was listening to you all, and I wanted to say that, like JB, when I heard about Shofu, I was like, "Hey, who's Shofu? What's Shofu?" And then I started looking through a lot of the products, and I started realizing the name and recognizing the marketing. And I realized how many products of theirs that I was using in practice, and then it's just grown from there. So I wanted to add that. But Jeff, you carry on about your little incisal edge fillings.
I'm sorry, I missed what you said. I had to turn my speaker down because apparently I was getting in trouble in the Sky Lounge.
Did you not
So
bring your AirPods?
yeah, that's a whole other issue. So don't even
Okay.
get me
Well,
started there.
Brian, just a really quick side story. He was going to Starbucks this morning. His AirPod case dropped. Apparently, also an AirPod came out. He didn't realize that. Then he realized that it was missing, went back to the Starbucks parking lot to pick it up, only to discover it had been run over. So it's been a tough day to be an AirPod.
Yeah, and literally, I have the same pocket of my bag that the AirPods always travel in, and reach for them today, and not there. So
Oh, okay.
that happens
Right.
every now and then.
Well,
So hey, tell Brian if he has Apple Care on the AirPods, it's a real easy fix. It's a lot less expensive than buying the whole thing.
yeah. So I'm just happy it's not me. If this is a safe place, I don't know if it's safe in the podcast or not, but I probably now own close to 10 left AirPods. And I own 2 right.
Why do you always lose the right?
Huh?
Why do you always lose the right?
I always use the right one. And do you know why? Where
Why
I
do you
lose
always
them the
lose the
most,
right?
where I lose them the most is at work, because I'll put an AirPod in on the right side if I'm doing like a really long case, but I don't want to be super disrespectful to the patient. So I won't wear it on the left because they can see it on the left. So I'll put it in my right ear. Then at some point, I'll put it in the pocket of my scrub jacket, or I'll throw it into my purse, or, I always have great intentions to do something later, and then I end up with only lefts.
Yeah.
So.
Well, in all fairness, I have no clue where my AirPods might be right now. They could literally be anywhere
They
because
could be anywhere.
they are not in the pocket of my bag where they are supposed to be.
Do either of you all wear contacts?
I do.
Jeff?
No, just readers that I have to bring with me all the time.
JB, what eye do you run out of the most on your contacts?
I'm pretty even actually on that.
I'm a right eye contact guy. I always have more left eye left at the end of the year.
I am the
right
same in both. That makes my life really easy.
No,
I have
that
no
doesn't.
idea.
So you don't know.
I have no idea.
No, you don't know. You don't know. So there you go.
Do you guys want to see what goes on at a Delta workstation?
Yes, please.
I'm sitting at it right now.
I dare you
Yeah.
start hanging around on that computer.
Hey, got the upgrade.
Hey, that's all that matters. That's all that matters. Okay.
Yeah.
I want to talk about this because look, this is again a safe space, right? So when you guys introduced me to Shofu and I didn't really know the company, I started with the restorative materials, and I'm not going to argue with you, Jeff. I carry around my Shofu compules. This has been an amazing workhorse flowable for us. I use it all the time. And we'll talk about the benefits of that. I'll let Chad spend time. But I'm going to geek out on this for a minute because I had no idea about this camera. And I talk about this camera in my lectures a lot. And the reason is a couple. And I want to highlight some of the features that for me as a clinician have meant the most. The first is it is 100% cavicidable. And look, it's still in great condition. And I've had this camera now for about 4 years. And it still looks as good as it did the day that Chad gave it to me because he had an extra one. So see? Anyway, wipe down all the time with Cavicide, no problem. The other thing is you're not going to be able to appreciate it. But when you turn this thing on, it has all these presettings that it knows that you're a dentist and that you want to take dental photos. So I can give this camera to just about anybody in my office, and I'm going to get really reasonable photos. Now, they might be crooked, okay? They might be crooked, but the lighting of teeth to gum to face is just about always right. And that's because it already has all the presettings. Sorry that it's mirrored, but you can appreciate it. Knows you're a dentist. It knows you want to take dental photos. So it's already got all this stuff. So you pick the mode and then you start teaching your team how to take photos really easily. If I give them a DSLR, Godspeed. Godspeed.
So you just really mentioned the most important piece of what that technology does. And that is the fact that you can hand it to anyone, as you said,
Yep.
and literally teach them to take photographs that you would be proud of most of the time on the screen
Absolutely.
in front of other dentists. And there is no other way to do that. You cannot do that with, an SLR, and you can't even really do that with an iPhone, because even though the iPhone will take some good photographs, you're not going to get the proper lighting with that. And the other piece of that is, who really wants to use their iPhone with their dirty gloves and
No,
worry
that's it, right?
so
Wipe it down.
the fact that you have something that can be handed back and forth,
Yep.
can be completely wiped down. I think the piece for me of lecturing that's always been the most difficult was saying, okay, I had this great case that I should have gotten
Yep.
images of, but I didn't get them because I wasn't available or I was too busy to grab the SLR and get the proper
That's exactly
photographs.
right.
And now there is no excuse
Yep.
for not getting the photographs that you want.
That's exactly right. 100%. The last thing I want to highlight, because I didn't appreciate this feature at all, honestly, maybe until Jeff showed it to me. I can't remember which time I learned it because he really was the one that kind of turned me on to it. But it was, I'm going to show, let's see. Yep. The shade photo.
Oh,
To
yeah.
me, that is
with
huge.
the black and white,
That's
just
exactly right. So
to
if we look
judge
at
value.
this, shoot. When I lecture and I show people the black and white versus
The isolate shade feature.
isolate shade, guys, I didn't appreciate what that did for value. But do you know how many times that saved me on a case where I'll go up and do, I'll say, okay, team, go ahead and take your shade photos. And I've taught them, they're holding the tabs up, they're taking the photo, they're really convinced it's an A1. And then I'll say, I don't know, something seems a little off. I tell you what, just to make sure, go take it in the black and white, and then go ahead and take it with an A or an A2 and a B1 just so I can compare the value.
That's right.
And then they come back and it's a totally different shade. Totally different shade. I'm like, nope, it's definitely closer to a B1 in value. So we need to send that to the lab because now they have to compare and contrast between the shade tab photo and the isolate shade. And our shade matching has exponentially improved because we are not just sending traditional photos anymore, but we're sending that isolate shade.
Did you see my post? So last Friday fail that I did was about just that. It was about shade. And I'm sorry for the background noise, but that I cannot control.
No.
But you know, that is such an important key, is that to date, I still have not found the ideal shade matching tool. And that has been the simplest process for me, is that, and as John Coyce would say, it's an always. When we take a shade, it is a photograph with my dental eye camera with the shade tabs up against the tooth so that the lab can look at both shade and value at the same time with some different shade tabs there. And, you know, as you said, you know, the number of shade remakes exponentially went down when I started, you know, utilizing that.
You guys have the newer cameras, I think.
No, I have I have C3s also.
Okay.
They're just still holding up so well. You know, I mean, I know Shofu is probably mad at me for saying that, but my C3s are just holding up so well.
I know.
You know, the thing is the body's still the same. The technology is mostly the same. However, they just add a couple of features. So like when the C3 went to the C4, one of the features that I have in the C4 is the movie feature. So like I can actually film a video utilizing the camera, and I don't know what the changes are with the CI5.
I was going to ask, because I've seen some movement on the shade stuff, and I don't know if the 5 does this or not, but totally turning off pink, like turning it off to complete grayscale. I don't know if that changes it in as much or like really moves the needle versus the shade isolation setting. So I was curious to know if that was different in the 4 or the 5.
I don't know that I've noticed enough difference, but I mean, mine's pretty much black and white.
Guys, it's just exactly the fact that I can give this to them and I'm not worried. Do you know how crazy concerned I am about the DSLR when I give it to somebody? It's like off balance a little bit, and you know how expensive the lens is. So if they drop it or scratch it, it's a problem. But I give this to them and I'm like, yeah, go ahead. It's fine. Just go. You go take your photos. You're going to be fine. I'm pretty sure you could drop it and it would still be okay. I haven't proved the concept, but I think it might actually survive a small gravity fall, maybe a small one.
Well, you know, one of the things that I want to point out too, this is really interesting. And JB, you were there to witness this. One of the greatest compliments that you can receive is your photography is fantastic. And we were in Florida at Longboat Key, and Dr. Ross Nash came up and complimented my photography. And people do not believe that nowadays, I can tell you without a shadow of a doubt, for the past 5 to 7 years, every photograph in every single one of my lectures is taken with that camera. And people don't believe it. They're like, oh, how do you get those good pictures? I'm telling you, if you learn how to use it, which isn't hard, you hold it down halfway, it focuses, it's ready to go, it clicks, you're done.
Can we please get raw images, Shofu? That's my only ask. My only ask is to have a raw image conversion so I can prove to an accreditation organization I have not manipulated the image in any way. That's all I'm asking. That's all I'm asking.
Totally.
And that's the only thing. That's one thing that I would say too. I never manipulate the lighting on the photography.
Ever.
The only thing that I do is crop and rotate. That's
yeah,
it.
sometimes you gotta.
And that's completely legal.
I know, but I'm just saying if it's not raw, you actually can't submit it for a lot of accreditation requirements.
And honestly, the only thing I have ever done is delete the picture and use someone else's picture.
Yeah, I've done that.
Subscribe
too,
to that
yeah.
method.
I have done that
I am
too.
a really good dentist because of Chad's dentistry.
Yeah,
I'm
that's right.
teasing.
Yeah,
No,
yeah,
it really is. It's you do not have to manipulate these images because they're good. The LED
That's
lighting is custom set for if you're doing a mirrored image, it changes the lighting so you don't get a bad, glow and reflection. If you're doing surgery or a close-up, it changes the LED lighting appropriately. If you're doing a macro image, it changes the LED lighting appropriately. And there's just no other way, as you said, to hand this to somebody and expect to get that type
Right.
of an image. So that's what I said. To me, there is no bigger no-brainer in dentistry.
All right.
Additionally, if you have, your overhead light from your loops on, the wing lights on that camera will overpower your overhead lighting, and your overhead lighting will not alter the photography. So
That's good to know. I've never taken a photo with my loops on, so I'm really.
I just got asked
done
where
it.
the showers were.
The thing is, hey, JB, as you get older, you're going to need your loops on because those are dental readers.
Yeah.
Those
I
are
get it.
dental readers.
I get it. All right, Chad, what's your favorite product? Let's put it out there.
I got 3. But let's start with this one.
Okay.
So Shofu is pretty damn innovative. Like they have a bunch of great consumables, polishers, composites, polishing discs, and so on and so forth. But we've already spoken with one of their pieces of technology, but actually they have several pieces of technology. And a couple of years ago, they came out with a laser. And if you're from Texas, you kind of collect maybe firearms. You're like, oh, hey, I gotta have this one, I gotta have that one. It's just things that you gotta have. Do you shoot them? Not really. If you're a dentist and you really like technology, you kind of collect lasers. All right. And I tend to collect lasers. Now, I have a lot that I don't use, and my motto is that every single practice needs to have a laser. That doesn't mean that you're going to use it every single day. However, you have to have a laser. So I have a couple of must-haves for a laser. The first is that I would love for it to be wireless. I mean, several years ago, there was a laser from Denmat that was the NV laser. It was the size of a pen. It was fantastic. It was wireless. It did everything that we needed to. Little bitty diode laser. You could carry it around in your pocket as long as it was charged. And the thing is that about every 9 months, it would crap out on me. So fast forward, now the lasers that I had were wireless. They had filaments. They had this. They had that. And Shofu says, we've come out with a laser. It's wireless. And I'm like, all right. They're like, we'd like to send you one to try. And I said, okay. So I tell my assistant, and I'm like, Kathy, you need to go to the back and you need to remove the other lasers. You need to make enough room for the same amount as that laser over there, because we're going to need to make a big space for this. And this thing arrives in the mail, and here it is.
It's crazy how small it is.
That's it.
Yeah.
Now, what I really like about this is 2 things. One is that what you see right here is the laser 2 inches in diameter. And then that's the footprint that it takes up. It's got a charger, it's got a plug, and it's got this. Boom. And the other thing is that when you feel this, I'm not going to say that it's heavy, but it's heavy enough to realize that it is sturdy, it is robust, it is durable, and it's going to withstand the test of time. So they sent this to me to beta test it. Now, the one thing is that when you've got something this small, there's a lot of safety features. So there's a lot of playing back and forth with the buttons. And I always joke with my patients, You're going to see me reading the instructions, but that's just because I need to make sure I know how to turn it on. I know how to turn it on into ready mode. I need to toggle.
Yeah.
And I said, but there's 2 buttons on it. That's it. I love that feature of it. I love that there's just 2 buttons. And when it fires, it's ready to go. I can use it for so many procedures around the office. The price point is nothing. I think it's like, let's say $4,000 for this. Okay. Let's just say
but I don't even think it's
maybe
that much.
less than that. I always want to go over than under.
Yep.
This has been one of the best investments we've ever made into our practice. The beauty of it is that, we have CO2 lasers, we have diode lasers, we have corded lasers, we have cordless lasers. This is my go-to. And the reason being is that I'm in the middle of a procedure. You didn't plan for it. Oh crap, I need the laser. Hey, can you go grab me the laser? They grab the glasses, they grab the laser. There's no foot pedal. All there is a little tip right here.
Yeah, that's huge.
That's bendy. It can be it can be initiated, non-initiated. It just depends on the procedure that you're doing. And it's a workhorse in the practice. It's freaking fantastic. As a matter of fact, what I thought I'd do tonight is I'm going to turn it on and I'm going to do a cornectomy on myself.
That's a great idea.
That's easy.
Let's do some crown lengthening. Just a quick gingivectomy up at the top.
No, just truly the Dentalaze is what it's called. I'm going to hold it up to the screen.
Yep.
Dentalaze, and it is a fantastic piece of equipment.
I'm going to say I bought one. So I've been Picasso AMD back in the old school days. And because honestly, Chad, when we opened and we really wanted when we wanted to have a diode in our practice and we were young and we were just starting to open up, like price was a big deal. I just needed it to cut, and AMD at the time was the price point that everybody couldn't compete with. It was like $2,800. But I will say it was like this big unit. You had a corded laser. It had a foot pedal, all the things. And the way that we run our office and the way that we manage our overhead, I'm not going to buy a laser for every operatory. So that meant we were moving lasers around, picking it up, unplugging it, plugging it back in, doing all this kind of stuff. So AMD's gone through some life cycles with the company and there's been some challenges and these are not overly expensive diodes. So we're sort of in that situation. So I thought, you know what? I'm going to try out the Shofu laser because I love the fact that it's wireless. And I really think that would be better for us, that we could move it between operatories so much easier than what we're currently doing. And I absolutely love it. Absolutely love it. And I will say, I don't like a CO2 laser because I actually don't like the weight in my hand. I don't like the counterbalance system. I've really struggled to find a CO2 laser that feels really good to me, that I think, oh yeah, I could do a whole class 2 prep with it. It just doesn't feel good. I don't feel the weight of this diode at all. I don't feel like it's cumbersome or uncomfortable. And that's coming from a diode that had really like a pencil almost for a tip. That the AMD or the Picasso laser tip was very light. I don't feel like when I pick up the Shofu laser that I'm like, oh, this is super heavy. I can't imagine doing a whole procedure with this because I think I would get tired. It's super comfortable. Super comfortable.
It really is. And that's what I say. It's heavier, but it's almost like going from an air-driven handpiece to an electric handpiece.
Correct.
The electric handpiece is let's face it, if you were to compare apples to apples, it's going to be much heavier for an electric handpiece versus an air-driven handpiece. However, there's power that comes with that electric handpiece that you're never going to go back to the air-driven handpiece.
That's right.
And so I find this to be, just a really beneficial piece of technology to have within your office. Now, it is going to be, the thing that scares me is like, when you're talking a diode laser, I'm going to compare it to, let's say, a Mercedes or a Lexus. When you go to a CO2 laser, you're upgrading to a Ferrari or a Lamborghini. All right. But that's because of torque. That's because of power. That's because of so many things.
Yeah.
This is not going to cut like a CO2 laser. But quite frankly, if you're not an experienced laser user, a CO2 laser is going to scare the absolute living crap out of you when you first use it, because it'll cut through a frenum like butter. It'll cut through, you'll fillet that tissue in no time. You've got to have some experience. This one here is basically an electrosurge without all of the pitfalls and downside of said electrosurge.
Yeah, and I have an erbium, an Nd:YAG, I think, or no, an erbium YAG. I have an erbium YAG. I have diodes. I have PBM units. I have all kinds of lasers in the practice, regardless of the sophistication of your laser portfolio, if you will. A diode is just a tried and true workhorse that will hop from operatory to operatory. And I'm telling you, Chad, while I can appreciate the power of the CO2, I can't imagine doing super long procedures with the CO2 laser, because I've never found one yet. And that's just me, but I haven't found one yet that feels really comfortable, that I'm like, yeah, that's not too heavy. It's not too awkward coming in. It takes up a much bigger footprint in the operatory. You got to roll it around and do all that. That pencil diode, you just pick it up, go. If I'm just troughing a crown, I don't need to be fancy with it. I'm just trying to open up enough so I can take a freaking impression. Like I'm not trying to be a rocket scientist here.
I totally agree.
Well,
totally agree.
In Texas, your hygienist can use diodes, correct, for intracellular therapy? Or no?
Yeah, they have to be laser certified, but quite frankly, what does that really mean?
I know.
Yeah. So, yes, they could. We really don't in our practice, but we could.
Okay.
We do a lot of aphthous ulcer treatment, vrenectomies, gingivectomies, lots of things that you can do with the laser. But I'll tell you, it's just a fantastic
What's your second favorite product?
You're next.
All right. I will tell you what my second favorite product
is. You go,
is.
and then I got a big one, because Jeff already hit on one of them that I was going to talk about.
Okay. Well, I'm going to let you do that one, because I don't think you have this. But so I talked to you about the Eye Special. The camera was my favorite, but my second favorite is the Super-snap. And actually, hold on, I got to grab something, because I forgot that I brought it in its oh, here it is. Okay. So you can either buy it in this really large kit and you just stock it, I keep it in my anterior composite kit because it's really helpful, and I'll go through what's in there. But this, for me, this was huge. This little Super-snap kit, it even comes with a little disposable mandrel, so you don't even have to keep up with a mandrel. And you can just load these 3 or 4 little Super-snaps on there, do your finishing, do your trimming, do your polishing, all that. Okay, things I love about this. I use the black like 90% of the time in anterior restorations. Love getting a fresh, crisp, and incisal edge with that black. It's so lovely. I love there's no metal in the center. I don't have to manage the circle. You've got the old tried and true snap discs that you put on the mandrel, the metal mandrel, and you're cruising along, but you can only use the outer rim of the circle. I didn't even think about that with this. I'm cooking, right?
I'm telling you, I think I drive the assistants nuts, because I use those on probably, I'm going to venture to say, every single procedure that I do. I utilize those discs.
Do you really? Like even posterior?
Posterior, I love it to finish the interproximal contacts with the double-sided one.
That's nice.
And actually, we have a new associate in the office, and I showed her how to do that, and she was very appreciative that I showed her that the other day. if I'm doing a buckle class 5 on a posterior,
Yeah.
I will go black, purple, green, and then I'll come back with my polishers. If I'm doing temporaries, I'm finishing my temporaries with the discs. I mean, I don't know. I believe there's someone out there called the disking queen. I'm going to challenge her because I might be the disking king.
So the other thing I'll make a note is there's 2 different sizes, and these are all disposable. So you're just gonna, do your adjustments and then throw them in the trash. I love that too, because my team can't always keep up with stuff. And anyway, I think this little disposable pack, I just have in every operatory, and then, we use it and trash it. It's fine. In case I need it. But I got to tell you, I know this show is kind of all about us, but one of our really good friends has been out there. She was in the same boat, I think, Tiny Sue, correct me if I'm wrong, but
I'm just
oh my gosh, why are you screwing around with her? Okay, I think she was in the same boat as I was when I said, "Hey, do you use anything for Shofu?" And she's like, I think you said, "What's Shofu?" Maybe.
Mm-hmm.
I knew them from like their polishing cups, right? I think I knew them best.
Right. Oh yeah.
Yeah,
right.
I think in dental school, maybe we had those. And like when I transitioned into practice, that's what we had. And so I started using a few other of their products kind of gradually. Most recently, a lot of their composites, especially being in public health. The geomer that the composites have, I think is just really, really awesome and like so rewarding, especially for like high caries risk patients. And so any little bit helps. And those composites have been great.
So, hi, Tanya.
Hi.
How you doing?
Good to see you.
Good to see you. Do you use the discs?
I do. Yeah, I like them. I like the 3M discs, but what I like about these Snap-on discs is they don't have that circle in the middle.
The metal in the middle.
Yeah.
Metal in the middle, yeah. And the other thing is like I will line them up on the tabletop with the little insert thing sticking up, and I just pop them off, and then I just take the handpiece and pop them right into the next one.
Yeah, that's nice.
I mean, I don't even pick them up. It's so easy, and every single case, I think if you ask my assistants what I use the most of, they're going to tell you those discs.
Yeah.
They're great. I think they're great. They're great for anteriors for sure.
You brought up something called Gymer technology, and I know that Jeff touched upon this a little bit earlier, but JB, would you pick up your not your silver sheened one, but your Beautyfill Flow?
Yeah, that's this one, right?
That maybe. I have this tube here.
Oh, well, that's the X. So I have the X as well.
No, I wanted you to pick up the Flow first.
Yeah.
You like your flowable and partials?
This is the Flow Plus in the single compule.
So this right here is Beautyfill. I'm just going to say Beautyfill Flow. This one is the Plus X. But this is probably their stock and trade Gymer product, which Tanya alluded to a little bit earlier. The Gymer product is really a product that's somewhat bioactive. It's got 6 essential ingredients. God, I wish I could say them. I know it's FBASS, so it's fluorine, fluoride, bromine. Is it bromine?
It's not on my tiny. It's not on.
Hold
here.
on. I'm gonna bring it up real quick because I want to make sure that I get all of this correct. But I'm super excited about this. I want to give them the total package when we're talking about this. But basically, they were pretty much bioactive before bioactivity was a thing. And what it is that they have a product that releases, it is fluoride, strontium, sodium, aluminum, silicate, and borate. And so basically, this has it's a lot like a glass ionomer, or more so like a resin modified glass ionomer, but it's all in the package of a composite. And it recharges and releases just as a resin modified glass ionomer would. And so when you put this product in, it's going to be antibacterial. It's going to, there's a slide that they have, and I don't know that the slide is as powerful when you first look at it unless you actually read it. But basically, it inhibits plaque formation on the restorative material itself. So there is a slide image. There are two SEM slide images, and one of them shows the plaque accumulation without the material and the plaque accumulation with the material. And then you realize how much it's magnified, and you realize how truly powerful this is. It's very acid resistant, very antibacterial, very anti-plaque, and it really does a wonderful job in the oral cavity. Jeff had mentioned this before too, but it is my absolute go-to for aligner attachments. And I love not only the antibacterial, antimicrobial effects of it, but what I really love is the aesthetics of it. So you've got this wonderful product that's packaged, that's got great science behind it, that has, you know, a great antibacterial, antimicrobial, anti-caries effect to it, and it's also extremely aesthetic. And so they had the Beauty-Fill Flow, which was highly filled, and then they came out with the Beauty-Fill Flow Plus X, which was even more highly filled. And when you look at that, there is absolutely zero reason to be using anything other than these products, because the polishability is as good, if not superior, to the majority of the traditional composites on the market, with the added benefits. And so the Flow Plus X is the one that I gravitate towards because it's more highly filled and more polishable, but you're going to get great aesthetic results with both of them. They're great for incisal edge fillings, like Jeff mentioned. They're great for class 5s. The other thing that's wonderful about them that I failed to mention is that they come in multiple viscosities. And when you look at their viscosities, they have one that'll just flow right into a class 1, and it'll just kind of fill the entire cavity, and you just take a little micro brush and just move it off. And then once you're done, all I really do is come back with a little jiffy brush and polish it off, because it's a very highly polished surface. And then they have one that's more viscous that will actually flow into a class 5, and it's somewhat shapeable, but it'll hold its form for long enough for you to place it and cure it and get a really nice result. So it's very thixotropic when you get into the higher viscosity material.
So Tanya Sue, you've been using Shofu and starting to experiment a little bit more with it in your practice. Tell me a little bit about your experience and like what you've noticed.
Yeah, I probably started incorporating it more into my workflows like the last 6 months or so, maybe a little bit more. But it's so interesting that Chad mentioned the different viscosities on these flowables, because the F00, the one that isn't really flowy, it's a little bit more tacky, is so weird to see, right? Because we're used to flowables flowing, right? They flow into crevices, they kind of go where you need it to go, or they go everywhere. But this not as flowable is really interesting because it kind of just stays there and you can manipulate it where you want it to go. But I also think that this could be really useful if you need to like tack something on, maybe like a veneer or a long-term temporary, you need a little bit of flowable. I think this is an excellent flowable to use. But back to what you were asking me, I do have some cases to share if y'all wanted to see any. Just some bread and butter dentistry, nothing too crazy. But let me see.
Absolutely.
If I can share.
Yes.
Do I need to share them, or do you need to share them?
I don't know.
Do you have a share option on your screen?
I do. Let's see. Oh, okay, cool. So we'll start with this one. Can you see this?
Yeah. Well, I could see it. Hold on. Do the, here we go. Oh, we probably did it at the same time.
Okay.
Cool.
Look at that, you little rubber dammer.
Yes, I do love Rubber Dam, and I kind of go back and forth between Clinician's Choice Rubber Dam and the ISO Dam, which are great rubber dams. But I'm also the queen of not taking before pictures. Anyways, just, nice, simple class 1. So this is some Shofu composite. This is probably the F03 flowable, which I prefer. So I like my flowable to flow. And then I do think that this is the Beautiful LS. So I kind of just wanted to see how this would blend and polish, and I thought that this did a pretty good job. So,
Looks great.
yeah, I think the blend was really nice.
Really nice.
Yeah, really happy with that. Let's see if I can. Let's see if I can do this one too. So this was a tough case. And whenever I do these, I always ask myself why I didn't do a crown. So don't ask me. But this patient came in and had, this filling that was failing. And you could see that separation of this composite material from the tooth structure. So I did take a before picture here. So here we have this composite that was not doing well. And I really think that this has probably been in here for a while. But one of the reasons I think it was failing is because I didn't have a really good marginal seal. So remove the composite. We're a little bit subgingival.
I hate those preparations
Me
so
too.
much.
Me too.
Yeah.
Oh my gosh.
But this is a great product to use, right? If we're talking about the Gyomer that Shofu has, right? We really know that our bonding isn't going to be great if we're down in a root structure. So any kind of fluoride release that we can get down in here, I think would be really excellent. For me, to get a really good seal, I like to use these copper bands to really wedge in there and kind of get in there and get a nice seal. And yeah, once we fill it up, this is Beautiful, the regular, not the low shrinkage. And you can see that it's really a really nice aesthetic result. It's a Beautiful result.
Oh,
Yeah, so really, really nice. And here's our final x-ray. So I feel really
Look at you go, girl.
it looks beautiful. And did the
Thanks.
patient say, man, I really miss that old crappy composite? Like, I really miss it.
Yeah, they were very ecstatic leaving the office that the appointment was over because it took forever. These are tough. These are tough. And I have one more. So this young boy came in, fell on his face, broke this tooth, and we built it back up.
That looks awesome.
And
Yeah, so-
that's which composite is that? That's the Beautiful packable.
Packable.
Yeah, I do like their packable too, and I don't
Yeah.
think they give it enough credit. I think it's a wonderful product, but you still got the Gyomer technology and a really nice aesthetic composite. Once again, with the packable, so
Yeah,
the
this
flowable is not the only thing that they have.
Yeah, 100%. I use more packable in general. I don't really like to do larger restorations like this in flowable. It just doesn't really work well in my hands. And so this was something I wanted to try, and the aesthetic result I thought was really nice. I mean, it blends really nicely. And if this tooth continues to erupt, we can always just cut back a little bit. And yeah, so
Nice.
beautiful. Great composite.
I
I would
think
really recommend it.
I think what's cool about your story is that this was not a working composite that you had, nor was it for me. But I mean, honestly, once I got it in my hands and I started working with it, both the flow and the packables, it's now in my practice, and it just sort of naturally became a part of what we're doing. And I think that speaks a lot to the product itself. I mean, we don't take a materials company up here and say, I love everything about this company and everything that they make. There are things I like and things I don't like about them, but for sure we get the added benefit of the Gyomer technology, but also it's a really nice working composite.
Yeah, it's really nice. It's easy to handle. I
Yeah.
heat all of my composites, and I think that it heats really nicely. It does what it needs to do when you do heat it and kind of pack it into crevices and tight corners. And the polish is really nice too. So yeah, really pretty.
I think bioactives in general, I think in 10 years will be all we're using, because at the end of the day, if you have the choice between choosing products that, as long as they prove to be viable, if you have the choice to use products that are working to help benefit the patient versus inactive products that are just sitting to fill holes, I think clinicians are going to start gravitating more and more towards bioactive materials that in some way have either, what Chad was talking about, the low plaque attachments, they're feeding off the fluoride in the environment. They're doing something beneficial for the patient other than just sitting there.
100%. It's an added benefit to a composite that you're already using, and you don't have to do anything more. So I think that is awesome.
Awesome.
So we're running out of time, but can we?
Well, I have one more product. Do you have one more? Don't you?
Okay, well, you know what? Who cares about time? Go.
Yeah.
Do it.
Intraoral?
Yeah. So look, this is not new in the world of technology, but I will tell you when the intraoral camera came online 20 years ago, 25, maybe 30 years ago, it was huge for patient education. It's the same thing as I talk about today with intraoral scanning. The fact that they could finally take a picture of a tooth that wasn't a radiograph and show it to a patient, and then they could actually see the crack or the old silver filling or the decay or whatever. Like, that was super empowering. The problem was when I opened my practice, I hate you so much sometimes. When I opened my practice back in 2010, I think I paid $3,500 for my first intraoral camera. Does that sound about right? Now you can get this camera or any intraoral camera, but this one in particular for under $300. I mean, they're not disposable, but they're definitely encroaching the price point of disposable. And I think the fact that I spent $3,500 for a chic intraoral camera when I first opened up makes me nauseous.
We have a camera in our practice that's completely obsolete. I think my business partner paid $16,000 for it back in the day.
I'm telling you, it's insane what they used to cost.
Everybody that comes in, our office was built around these cameras. So there's like this little pocket in our cabinetry, and they're like, "Oh, you had an Accucam? Those things were the best. Those things were the best." And you look back on what you spent on them, but here's an added benefit that you didn't mention. Not only is the camera around the $300 price point range, it comes with a replacement clause.
Right.
Now, what I will say is that cameras have gotten to the point of being so inexpensive, they're basically disposable. You're done with it?
Yeah.
It goes right in the trash. This one here, it craps out on you within the first year. There is a discount after the first, within the first year to replace it if needed. After a couple years, it truly is disposable, but Shofu's done a great job of putting a little replacement disclaimer, if you will, on selling that camera. And it is a wonderful little camera. It takes great photos. I think everybody needs one in every op, and it's so affordable that you can do so.
For sure. And now at the price point, I mean, it's really dumb not to have one. And while I love an intraoral scan, and I'm a pretty big advocate for it, 3 seconds. 3 seconds, I can take a quick photo. If I'm prepping a crown and I get in there and I find fracture lines running mesial distal, I want to make sure I document my buildup. Whatever it is that I find, I can grab that camera really quick, snap a really high quality photo so I can send that to the insurance company, document what I saw when I was in there so that I don't forget when the patient comes in with biting pain in 3 years. And I'm like, oh yeah, well, had a giant fracture in it. So we've saved it for 3 years. Like, all that stuff is easily documented. You can do that with an intraoral scan. And again, I use them a ton, but that's way longer and a bigger piece of equipment. If I can just grab this little $280 camera or whatever and grab the things that I need, it makes it a very easy workflow process in your practice.
Can you grab that camera just one more time and show it to us?
I'm going to hit you in the head with this.
I'm just curious if you could. Yeah. Okay. Thank you. Is there time for just one last product?
One more.
That'll be a good one.
This one's obscure. All right. And I
we
say
deep
it's,
tracks now. We're deep track Shofu.
I think this one's obscure because I don't know that a lot of people know this exists. Once again, it's something that you're not going to use every day, but it's something you absolutely have to have in your practice. So have you ever done a composite like on the anterior and you're like, oh man, that looks so good, but it's just so monochromatic compared to the one next to it? It doesn't mean that it was like, it looked bad by any means, but it just could have used some characterization. Well, I'm Bob freaking Ross, man. I want to paint some happy little trees, and sometimes I want to paint them on teeth. And so they have this product called Lite Art, and you can look. I label everything for our team, and this one says composite staining on the
This
outside.
is deep track. I love
But
it.
it's called Lite Art, and basically you can go freaking totally Bob Ross on this, and you can mix all your colors together. There's a lot of palettes. However, I like, one of the things that I love doing, and a lot of the orthodontists refer to me, is peg laterals. So I'm going to show you this case. This is one we did a couple weeks ago, and I always say we can make ugly teeth look pretty, and ugly teeth aren't necessarily ugly teeth. They're just the way that that patient presents with them. But this is a case that we did last 2-3 weeks ago, I should say. And if you look, this is not poor hygiene. This is just the way that this young lady developed. So, people will be like, oh, icon this. Icon is, you're going to spend more on icon to fix these than icon's worth, and icon may not work on these. This is really just modeled enamel. It's very strong, very sturdy enamel, but this young lady's mother's teeth are the exact same way. And so if you look, what we did is we did a milled hybrid ceramic on tooth number 10. And hybrid ceramics are beautiful because you can cut them back, and Shofu actually makes a really nice one of those as well, which is called the Shofu HC block. So anyways, I milled a hybrid ceramic, and I just cut it back in certain areas, and I came in and I mixed a little white and a little yellow, more white than yellow, and I just stained tooth number 10 to try and match the rest of the dentition. And then I came back with a translucent composite over the top of it, polished it. It's light cure. I don't know that it's Geimer technology, but it's a light cure pasty resin material that'll just fill it in. You can cover it up with a translucent composite and polish it just like the rest of your composites. I use this all the time. And
I love this case. I love this. Are you doing it too if you're doing like a layered composite and you can add different
Absolutely. You can add,
I love that.
add little incisal halos. You can add little, how I hate to say mamelons, but how there's kind of a little peninsula that goes up into the mamelon. You can do that. I've got another case that I'll just share with you all real briefly if I have it on here. This is a young man. This is a really cool story here. Let me see if I can find this real quick. This young man is a foster child, and he's kind of had a tough life, and he fell and broke his front tooth, and he's about to undergo orthodontic therapy, but he was starting his senior year of high school, and I just wanted him to have a tooth, and so anyhow, let me see if I can add this real quick. So he broke number 9. Let's see here. Let me remove that. Let me add this. Sorry, this will take just a second. I'm almost done.
I'll probably try those paints for occlusal staining. I'd really just like to see how that looks with.
Oh, they're great for occlusal staining as well. I mean, they're fantastic for pretty much anything. This one's a really interesting case. So this young man broke number 9. You can see that number 10 is displaced behind number 9.
Wow.
But as long as you get the base shade, This tooth is only, I did a hybrid ceramic that only covers half of the facial on number 9. So the gingival is exactly as it was. The incisal half is hybrid ceramic, and I just cut it back and added some of the hypocalcification spots to it and polished it. And I mean, this young man, he's 17, 18 years old. He wasn't saying, "Oh my God, that's so beautiful," but he had tears in his eyes because he had gone around through foster home to foster home with no freaking front tooth and now he's able to start his senior year with at least something that looked like a tooth.
Yeah.
And nobody can see number 10. So now Dr. Chow and I are working with him, and we're going to get him back in good orthodontic shape and try and get him all fixed up. But these stains are just fantastic. And yes, Tanya, you can use them on occlusal stains. But what I'm going to tell you is that the reason people come to you to get their teeth filled is to get the shit out of the grooves. So don't put the shit back in the groove, okay?
I just want to see how it looks.
I know, I'm teasing
I would
you.
totally do that. You got to see, because then your anatomy super pops out.
Yeah,
I just like to see.
yeah.
I think it looks really cool when people do it. It's not.
It
needed,
really
you know?
does. And hey, one of the best is Dr. Chad Perry, one of my good friends that lives here in Keller. He is a phenom when it comes to staining composite. And I tell him that all the time. I'm like, Chad, you spend so much time, but the people come to you to get shit out of their teeth, and you put the shit right back in it. He's like, stop it.
Can you come back later and bill for a sealant because you want to seal off the stained grooves? Is that no?
Maybe.
Yeah, you probably could.
Okay.
But
Maybe I'll stain it pink or something. Give it some character.
Everybody needs to try the Lite Art. It's actually kind
I'm
of
gonna have
fun.
to order a box now.
Yeah, it's really cool, and it lasts for a while. And you've got these nice little brushes that come with it, and a nice little white a little clear resin material to mix it with, and it's awesome.
Have you used any of that on your printed resins yet?
I'm not printing resins, but I mean the hybrid ceramics are the exact same as what you're printing.
Yeah.
Yeah, so you can use it on that as well. So, and we're doing it. And the other thing is, let's say you put a temporary on there, like some veneer temporaries or a temporary on 89, and the color's slightly off. Then just really thinly mix some of the yellow, the brown, and the white, and then just kind of run it over there and cure it. You're good to go.
Yeah, that's awesome.
Great products, across the board.
Yeah.
They also, I don't know if y'all talked about it, but they have pink composites, which I think is really awesome.
They do, and they are giant.
And I don't know if y'all talked about white stones, but I love their white stone. Their white stone burr.
And burrs. They have robotic burrs, which are pretty fantastic as well. So
great line of products for sure.
We could talk forever.
Oh, I think so.
Okay, one other really cool side story. The art in their marketing was drawn by one of the DINKs' sons.
Yes, the art.
Which I think is actually really cool. Like they have all this
Wait, what is
anime
her
art.
name? I cannot remember.
Huh?
What do they call the
anime? It's like anime. It's like Japanese style. Yeah, I don't remember her name.
There's a name for her. She has a name, right?
Yeah, I don't remember her name, but
well, anyhow, Luke Horowitz is very proud of his work with the Shofu anime. So everybody give Luke Horowitz a hand.
It's such a cool story.
He is the offspring of Jeff and Jenny Horowitz.
Mostly Jenny.
Mostly Jenny, yes.
Yeah,
he does look a lot like Jenny. He didn't get it. Are we sure he's Jeff's kid?
No.
No.
Nope.
Actually, Jeff was the father to a pot-bellied pig.
Yeah, Peaches.
Maybe that was his only child.
Maybe. I saw the resemblance, but I didn't want to bring it up.
Yeah, because Luke and Joel, they look
just like Jenny.
Yeah, they look like Jenny. They do.
Yeah.
They don't look like Horowitz's.
This is awkward.
Anyhow, should we go ahead and close out the show?
I think we should. Hey, it's really quick. Tanya Sue is heading to SmileCon this weekend.
Woo.
Lot of activity going on. I think this is going to be a really interesting year. I'm hoping you'll be our eyes and ears.
I'll be there for any other DINK watchers. If you see me there, or if you're at HOD, let me know.
Yeah, I know there's just a lot of activity. One, the ADA is really trying to clean up some fiscal challenges that they've gone through over the last couple of years, and to be hopefully more transparent on that. But there's a lot of outsiders now coming in and putting forth a lot of new resolutions and stuff. So a lot of activity.
Going to be a fun one.
It is going to be an interesting SmileCon.
What if DINKs sponsors popcorn for the House of Delegates?
Ooh, that would be good.
Oh,
Yeah.
that would be fun.
Just so you're sitting there and you're like,
Entertaining.
yeah.
No, I think there's going to be a lot of interesting discussion. Probably some needed discussion. Probably some not so needed discussion.
I always think, though, that it's important that we have open dialogue and that we're not
100%.
afraid to at least discuss ideas, whether they're uncomfortable or not, that at least you have a platform to make your voice heard. It's
I
really
completely
important.
agree with you. Yep, 100%. Well, thank you all for letting me pop on.
Thanks for popping in. Show us
we're okay.
your Shofu showcase. I'm gonna go ahead and put a little sprinkle out there, but we saw some of her beautiful work tonight. Tanya Sue's gonna host a webinar for us in January for some restorative practical protocols, etc. So we're really excited to have her do our first educational webinar of 2026, working on some direct composite work. So very excited.
Pumped. Really excited for it.
Well, as we close, I'm just going to say it's always an honor to be here with Tanya. And even though we were here talking about Shofu, one of the things that I want to say, hey, hold on, I'm getting to you. Hey, don't take me off my soapbox.
Okay.
I was about to compliment her. But no, I just want to say it's always an honor to be here with Tanya. Thank you for joining us tonight. And if you all look, this down here is the future of dentistry. And when she showed her screen, I don't know if anybody was looking like I was, because usually everybody just shows their good work. And then on the left side of her screen was all of her work. And it was all good work. So, hey, I hope
dentistry. We practice every day, but my hands are getting better. So thank you for the compliment.
I hope that everybody takes a little bit of a look at the left side of her screen rather than what's center of her screen, because there's a lot behind this firecracker below us. JB, it's always a pleasure to be with you. Jeff, I don't know if I could say the same. I don't know where the hell you were, what the hell happened, but it was good to see you for a little bit. We miss you, buddy. Hope you have a safe trip. And all of that aside, I just want to tell everybody that I think it was pretty obvious that we really admire what Shofu has done for our profession. We appreciate the products that they put into our hands. The excitement tonight was not because they're an educational partner, but the fact that they are an educational partner is because that's the excitement that we always have when we talk about Shofu products. So I want to thank Shofu for being an educational partner, for putting great products into our hands and into the hands of all other dental clinicians. If you don't know them, look into them. It will make you a better practitioner. And they are truly, making our profession move forward at a much better rate. So thank you very much, Shofu, for sponsoring our show, and hope to see everybody next week.
Have a great night.
Thank y'all.
And that wraps up another podcast for Dentists in the Know. On behalf of Dr. Jennifer Bell, Dr. Chad Duplantis, and myself, remember that we've got a great profession, so let's make it a great day, Dinks.